We now move on to another last and interesting session. This session is no PPTs here. It will be interaction. So I would like to invite Dr. Ganavi, Dr. Chinmayi, and Dr. Sujit. Please come on the video mode. These are our panelists, and why I have our team chose this session is that we spoke of so many things, and we say you do it. Dr. Ganavi, are you there?
Yes,
Ganavi,
ma'am.
can you come on the video mode? Yeah.
Yeah.
Dr. Sujit, you are there, right? Please come on the video mode, Dr. Sujit.
Yeah.
You are there? Yes. So I will just introduce them. They are our youngest among all the 5 resource persons we had all these days. Youngest but very valuable resource persons, right? So we have Dr. Okay, is a slide visible? No. Okay, I'll just introduce them briefly. We have discussed about so many things, and these people have worked very sincerely on their dissertation. Let us understand how they got through and what were their challenges. Is the slide visible? Yeah? Yes. So he is Dr. Sujit Pamujula. Am I pronouncing it correctly?
Yes.
Yeah,
Yes.
right. So got logged off. I don't know how. Okay. Next is we have Dr. Chinmayi. Is the slide visible? Is it visible? Am I audible?
Yes, ma'am.
We know, yeah.
Yes.
So she is Dr. Chinmayi. She is doing her MD in dermatology, and she was a junior resident. She is now at KIMS, and she is also a research scientist. I was in my first lecture, I was referring to Precision Medicine, one of the company which is doing on tuberculosis. An excellent work is this HealSec Precision Medicine. She's working with them for the past 3 years. Chinmayi, I think.
Yes, ma'am. Now currently in PG, I'm not into, but still as a consultant,
Okay.
external consultant.
External. Okay.
It's the company started.
Okay. And she is working on leprosy. She has worked on leprosy biomarkers, vitiligo, psychodermatology, AI in dermatology. Her key work is in tuberculosis, serum, IL-15. She's still doing her PG, mind you. She's giving exams in July, August. And presentation at Global Vitiligo Foundation, American Academy of Dermatology, presented various state and national conferences, dermatology quiz winner. And her vision is bridging immunology, biomarkers, holistic healthcare, and AI to enable predictive dermatology and all-round patient well-being. So very clear about her future. She has a clear vision about what she intends to do. Therefore, we have chosen these two. And third one, so Chinmayi has been my student at Vaidehi Medical College as an undergrad, and she is student of Dr. Nandini, who was the chairperson for our first session. And Dr. Sujit is associated with Dr. Ravi Kiran. Therefore, we have him on this panel. Dr. Ganavi was I know her since 3 years. Postgraduate, she has completed her MD Pharmacology from Hassan Medical College, MBBS from Kodagu, and she is a third rank holder at Rajiv Gandhi University. She has completed. And she has interned with me with Akshaisarathi Healthcare Solutions. She was an intern here for almost 6 months. And she is now clinical and medical affairs specialist at Teleflex India, support clinical education, evidence generation, stakeholder engagement. She is involved in training and scientific communication for interventional access and vascular interventions portfolio. Basically, she is contributing to the development of a medical device. And what I appreciate is she got numerous opportunities, job opportunities, of course, in industry, in the pharma, but she held for, she was very strongly holding that she wants to be in something which is unique, and and she waited for it for quite some time and gave up all the opportunities. In fact, she was a little anxious, but finally she was chosen among many for this job at Teleflex India. And she has been medical officer PHC at Hassan Healthcare Center. And she has published as author with multiple research papers and clinical studies on cardiovascular and respiratory diseases and tuberculosis. One of her thesis has been on tuberculosis. So with that, now we move on to discussions. They are all on the screen. You can see them. Let me start with this question. What was your research topic? And Dr. Sujit, what was your PG topic?
Mine was about it was a comparative study. So I have compared a drug called esmolol and dexmedetomidine to know the effectiveness of its hypotension in ENT surgeries, basically fist and septoplasty surgeries.
Okay, esmolol and dexmedetomidine.
Dexmedetomidine.
So you compare these two, is it? Okay.
Yes.
Okay. Why I'm asking is a similar research question we had given to our students. So follow-up. What was the follow-up like? How you followed for post-operative hypotension?
Not post-operative, intraoperative.
Intraoperative.
Yeah.
Okay, very good, very good.
So
And,
as I worked in this thing, corporate setup, so the patient's follow-up will be it will be very tough because the patients get discharged the next day. So I had to choose a topic which will be get done within the OT itself.
Right. Perfect.
So I have to associate with that.
Very good, very nice. And how did you find your topic? You yourself found your topic, or your guide helped you, or how was it?
So I had some 3 or 4 topics from my side, ma'am, but the finalization of the topic was done by my guide. Who's
Okay.
HOD, is our HOD. So
okay.
So while choosing those at the time when I chose these topics, ENT cases were at the summit, so I had to choose this. Yeah.
So that very useful information. You chose your topic based on the availability of patients and your liking, right?
Yeah.
And out of these 3-4 which you chose and took them to your guide, this topic was one of them.
Yes, ma'am.
This was one of them.
One of them.
Okay. So you shortlisted, and then you asked your guide to choose one of the best. And one of the reason was availability of your patients and the time. Right.
Yes.
Very good. Very good.
So whatever I had to do, it has to be within that few hours of interaction which I get with the patients. So,
Correct.
So I've gone through the data from the past 2 years, all those records, anesthesia records. So through those datas, we have summarized that these cases are mostly happening, and these many cases will happen in particular month. So like that, I have taken a call on choosing the topic.
Great. Very useful information. You have validated what we mentioned in our actually initial introductory sessions. Over to you, Chinmayi. What was your topic, and how did you choose?
Yes, ma'am. So my topic was serum interleukin 15 levels among vitiligo patients versus that of healthy controls. And so this was actually, again, I was honored to have as my guide Dr. Nandini, who was here with us in the earlier sessions this week. So she herself is a powerhouse of multiple topics. So she was quite clear when I was assigned. She said, no, this is a topic that's catching on because interleukin 15 is an up and coming marker for vitiligo, for the autoimmune memory T cell. So she was very clear that you have to study this molecule. And personally, I was very interested in vitiligo. Like personally, also in our family, there were so many people who had this condition. So definitely something that would contribute to furthering the management. So definitely in my case, I would say it was my guide who definitely kind of narrowed it down and helped me kind of streamline, because I was coming from the research background from the Indian Institute of Science, working in the company. So when I first joined here for post-graduation, I should say I had like a lot of wild ideas, didn't really know how to funnel it down to a postgraduate and like something that's feasible on a day-to-day basis. All the ideas. So one day she sat me down and said, look, these ideas can't be implemented at this point where you have to finish OPD, you have to finish rounds, you have to do academics, all of these things. So definitely a senior, the right guide, if you have the right type of guidance, they'll definitely help you narrow down your vision without making you feel demotivated or so that is definitely very important in my case, ma'am.
Great. How many patients you had to study? As
per statistician, I got a number of 40 plus 40, ma'am. So 40 vitiligo and 40 healthy controls. And for the serum interleukin 15, I had to procure the kit, ELISA kit. So it sort of worked out because one kit has 90 wells, and by the time all the controls are filled up, it comes around to roughly 85. So the sample size also, I was able to manage it with one interleukin kit. But the collection of samples and all that took a couple of months.
So it was a cross-sectional study, right? At one
cross-sectional.
time.
Cross-sectional.
Yes. Study. You collected the samples. Was there any specific time when you had to collect the samples?
So ideally, I wanted to go for untreated samples, like patients who had yet to start their treatments. But initially, I used to scrutinize. But the problem with the skin condition like that is they usually try everything else and then they come to us.
Right.
So by then, the signature would have got altered. So as I went on, I had to kind of improvise, and I just decided if they're not on systemic immunosuppressants, I would enroll. So it's a bit tricky to enroll that many number of patients in a particular time frame. Despite the high load that we have at our OPD, it was still quite tricky, but able to manage it.
You were able to do. So what was the cost of the kit?
So the kit came up to around 23,000.
23,000. Were you charged above this, over and above this by the lab, your hospital lab?
So actually, I had to procure the kit. This is not a molecule that's routinely tested here. So I had to procure the kit and give it to our department. So in our hospital, the microbiology department helped with the ELISA kit running, and also they were very helpful with that. So I did not have to use for it.
You spent 25,000 approximately. That's all. They didn't charge
roughly.
you.
I had to help them procure the tips for ELISA, the tubes, the serum cryovials, and also, of course, the technician had to stay after hours for a few of the analysis. So he expected a little bit of but not much, maybe in a few thousand. So maximum maybe around 27,000.
Okay, but it was worth it, I think, because the standard of quality of research is good with these kind of biomarkers, and it will get very well accepted in presentations and publications, I'm sure. Have you presented your paper with this?
Yes, ma'am. This was what I had presented at the American Academy of Dermatology last year. So I had a pilot set of about 20 plus 20. So that's what I had presented.
Okay, great. Ganavi, what was your topic in MD Pharmacology?
Hello, ma'am. Good evening. First of all, thank you for the opportunity and the brief introduction about all the newbie panelists over here.
Yes.
And so my topic was evaluation of frequency and severity of adverse drug reactions in MDR tuberculosis, ma'am.
In
So-
MDR-TB, okay.
MDR tuberculosis. Since the bedaquiline drug was included in 2021, there were very fewer reports about, the adverse drug reactions in MDR-TB on the patients who are on bedaquiline. So I was quite interested in respiratory medicine or in cardiovascular sciences. So my guide was interested in that, so I chose that. Yeah.
Very good. So, yeah, the topic was given by your guide.
No, like first of all, we did sat and we discussed like whatever is feasible in our setting. So we were either going with the pulmonology department or general medicine department. Then we narrowed it down to tuberculosis. Yeah, we explored few of the we explored in nephrology area also. Then cardiovascular. Then we funneled it down to respiratory medicine.
Okay. So it was a cross-sectional study, right? Or did you observe them, followed them?
Yeah, it was a prospective study, ma'am. I followed them for about 6 months and few patients till up to 9 months. So because few patients were also having XDR, that was extreme. So XDR for them we had to follow up for around 9 months. There was change of medications as well. So again we have to follow up them. So about 9 months each patient. I followed up them for 9 months, ma'am.
For 9 months. How many
Yes.
patients you completed?
So my sample size was about 52. So I was able to reach around 59 9 samples.
59?
Yes,
Okay.
9 samples.
You followed them up for 6 to 9 months.
Yes, ma'am, 6 to 9 months. So that in that case, I would like really appreciate the work of treatment supervisors over there. So we have 8 taluks in Hassan district. So all the taluks have treatment supervisors there.
Okay.
So I was in constant touch with them. So each of the supervisor will get around 8 patients. So it was easy for them to follow up and come in contact with them. So they were my primary contacts. So if any patient had any adverse drug reaction, they would immediately call me up and inform about it. So if it is necessary to intervene, I would call them to the hospital over HIMSS. Or if it is manageable in a primary healthcare center, I would just directly talk to the treatment provider or the administrative medical officer there. So that.
Okay. So you collected the data both the ways, direct supervision of patients as well as from the
Yes,
TB
ma'am.
officers.
Yes, ma'am.
Okay,
Depends
that is
on
how-
the
yeah. So it must have been, so quite a long duration, right? 6 to 9 months. But you did 59 patients.
Yes,
That
ma'am.
is really commendable. Yeah, good. Did you present this paper somewhere?
Ma'am, I'm yet to present it,
Yet to
ma'am.
present.
Yeah.
Okay. Okay. Did you all have orientation sessions in your institution when you started, Ganavi?
Yes, ma'am. I
Okay.
think you personally know Dr. Deepak sir, who is very much interested in research
Correct.
and all. He took that initiative of, a 3-day orientation session for
Okay.
all the PGs. So
Okay.
he had a great idea about how to go.
Okay.
And each and everything was explained to us in detail.
Okay. What about you, Chinmay? Institution had or your guide helped you?
Definitely, we had a single day training program by the institution, ma'am. But I guess in
Okay.
one day it was moderately useful, definitely
Useful.
about the
Okay.
statistics. But
Okay.
to personalize it to our subject, definitely guide and department.
Guide will
is
help.
very
Yeah.
helpful.
What about you, Sujit? Did you have which institution, which hospital did you do your DNB? Manipal?
The one which Ravi sir is working right now,
Same
Manipal Hospital,
Okay.
Vartur Road.
Okay. Okay. Did you
Mhm.
have any structured orientation or any kind of no? Guide has helped you. Guide
Yeah.
has helped you.
Guide, and there was one academic coordinated from
Good.
anesthesia team. So yeah, with their
Okay.
help only I have done.
Okay. Anybody else? Peer group or junior faculty or anybody? Did anyone else?
Usually the consultant who do the cases, yeah, they have helped
They
me
help.
with the collection of the
Okay.
data, everything. So yeah,
Okay. Okay.
and they have guided me how to go ahead with how to collect the data, what
Okay.
parameters you have to collect the data with. So yeah,
Okay.
they have helped.
So the thing is, apart from these orientations, which will only give you a direction, actually what happens in the hospital is your guides, your peer groups, your seniors, their contribution actually helps you to practically conduct your dissertation. Am I right? Yeah. Okay.
Yeah.
So I understand all three of you have doubly checked whether it is feasible, particularly from Sujit also. And Chinmay, did you evaluate? He clearly mentioned feasibility, novelty, and all those. Novelty, of course, I am sure it was there, both Chinmay and Ganavi. Feasibility assessment, were you able to? Did you feel that I should have taken up a more feasible project or more easy project? Did you feel
Yes,
that?
ma'am. And sometimes it did
Sometime?
feel like that, mainly because I was determined to kind of take it till the end. So I was very strict with my. So it started from blood drawings, then serum separation. I went to the lab personally, -80 refrigeration, all that. So definitely it was tricky at times, but I enjoyed the process. It
You
was
enjoy doing
very
it. Okay.
satisfying, and it was a
Okay.
very interesting
Yeah.
process.
Okay. What about you, Ganavi? Don't you think it was a very cumbersome topic for
Yes,
follow-up of 9 months?
yes, ma'am. It
Yeah.
was quite cumbersome, and unfortunately, Hassan have a burden of MDR tuberculosis. So
Oh,
achieving the sample size was not a big deal,
okay.
but following them up for 9 months, that
Nine
was a big
months.
thing. And
Okay.
sometimes patients will report the ADR after few months, like they experience it in the first month of treatment, but they will not know about it after 2 months or 3 months. They'll be telling it. So again, assessing the causality was difficult, but it was not included in my study. But I was interested in checking the causality of relation with the drug also. So
Okay.
so whenever the patients come to you, and again it's MDR TB, we have to be very cautious when we are
Correct.
examining the patients and all. Sometimes I felt maybe I would have gone for the easier one, but this was quite satisfying because we have very less data about MDR TB as of now,
Yeah.
especially about
Correct.
adverse drug reactions. And I don't
Correct.
think in Karnataka we have any data regarding adverse drug reactions as of now. So this would be a first study about it.
Definitely, definitely. The topics all three of you have taken are definitely a very interesting topic, very good. Feasibility wise, I think Dr. Sujit's was very comfortable doing intraoperatively and getting good to this one. Others, it depends on your how much time you are ready to give, how much time you're and how passionate you are about that. Otherwise, I think majority of the people, long follow-ups may be a little cumbersome. Better to choose easier ones. But if you take, I mean, it's directly proportional to your effort. See, Chinmay was able to present her paper in the American Dermatology Association. That adds a lot of credibility. And what do you think, Ganavi, this kind of effort which you put, very hard work, this was really a great commitment, what you have done. Does that help in your career or in the current job or any kind of job profile which you will be undertaking, which you have already undertaken? Does
Ma'am,
that still add value?
yeah, this project like easily landed me with the Zydus offer, ma'am. Actually, just by
Okay.
looking at the topic only, they wanted someone to a respiratory portfolio, and they saw this. And I gave only one round of interview, and I was there in front of medical affairs VP for the second round. So that was a big advantage for me. So I think, yeah, it helps, but it also depends on how do you see yourself. If you are interested in particular topic, or if you want to pursue it after your MD also related to that therapy area, I think it would be advantageous. But it totally depends on the interest, ma'am.
Okay. No, that is related to the area topic. I'm talking about the skill or the effort that you put in following up with the patients, the communication, interaction with other people like TB officers. You had to have that contact, right?
Yes,
Otherwise, that wouldn't have helped. It was a totally, no, your interpersonal skills must have helped. Of
yes,
course,
ma'am.
with your guide, but then.
There was a lot of cross-functional team collaboration was there. So I was in very close contact with general medicine HOD, pulmonology HOD, and district tuberculosis officers, and most of the AMOs in Hassan district. So I was able to understand the ground level reality, whatever they face, okay, in treating a MDR case. Sometimes the patient will not come for the treatment and all, but
Okay.
it's the doctor's responsibility as well. If any cases in that area, they are answerable for it. So I was able to understand the ground reality of treating a patient with MDR TB. That was there.
Okay.
And yeah, that is the main thing I learned. And obviously collaborating with various teams, and just uh, eh, explaining to the treatment supervisors why I am doing this, what is this, what is the importance of this. So that was also, and getting the data about each, and they'll be skeptical to give you the data because
Correct.
it's very confidential data.
Correct.
So that was initially, it was quite difficult, but we were able to get through it with the help of DTO.
Great, great. Dr. Sujit, uh, this dissertation which was taken, What is your opinion? It is enough if we take a very particularly for DNB students and clinical subjects and critical care. You have a lot of responsibilities in your hospital. So dissertation, how seriously it should be taken? How does it help in your clinical practice? Does it add value to your treatment care, patient care now what you're doing?
Definitely, it should be taken equally important as your academics, because
Okay.
all these research topics, whenever you give the public publication or when you publish in the other articles, so these are the based on these only they will perform the meta-analysis, all those materials, whatever the results, whatever the guidelines they make, it all go through these research papers. So from your side, when you do when you do a dissertation, you have to do it a bit fair, so that
Okay.
it will add up properly to the
Yeah,
pool.
correct.
So, and obviously, when you write a thesis or when you choose a topic for a thesis, so you will obviously go through some few few publications or few topics where you have to go through the material very detailedly. So on based on what parameters you have to choose, you will learn a lot of new things. What was the methodology? What were the tools they have used? What were the study designs? So you will get to gain a lot of knowledge from those topics if you show some interest.
Correct. Good, good. What about you, Chinmay? Do you think this kind of dissertation topics which you chose particularly, which is more research oriented and advanced, I should say, for a postgraduate, choosing biomarker in clinical subjects. So how does it add value to your future clinical practice or clinical career? Taking your dissertation, yeah.
Yes, Bob. So that's what, as doing it in the middle of a busy day and when we're actively doing a post graduation in the middle of seminars, all that, it is definitely challenging. But I think I learned a lot of people skills, like you mentioned. Having to, we only have 2 minutes. Like literally, I would have to ask for permission, step out of the OPD. Okay, I'll just take this patient for 2 minutes. We only have 1 or 2 minutes to convince this patient. Okay, we're doing this. Take the informed consent, do the checking, fill the pro forma, all that. Literally only have 2 minutes. So it depends how we convey what we're doing. Some of them say, okay, if you've done this blood test, now will my treatment change? So it's tricky to answer sometimes, to explain to people who are not very aware that this is a research question right now. So if we do this, maybe in the future, it becomes a therapeutic target. So it's difficult to convince. Sometimes they may be upset or they may say, okay, you did this, but nothing changed. All those myriad little things, definitely it helped me, like, I developed the patient skills more, especially in dermatology, where talking is like 60 to 70% of the therapy is just convincing the patient or talking or calming them down. So I think that aspect, because it was having to be done under such a high pressure environment, it definitely helped hone my patient skills. And also I got to do a bit of hands-on wet lab things.
Yes.
Serum extraction. I sat with the technician. He taught me how to do the serum extract, how to identify whether it's been extracted well, a bit of both. But as for other postgraduates who don't have a very active interest in research, I would say it would become a little difficult, because in between they may lose the motivation to continue. If it starts looking difficult and they're unable to look at the bigger picture, it could become tricky. So in such situations, I think while starting out, we should be very clear about how invested we are in this, how invested are we to see this to the end, and not just finish it as a formality. So if it's being done with that attitude, I think the topic that should be selected should be a little lighter. So that is one.
Precisely. This is what I wanted, actually. Yeah. Ganavi, so all of you achieved the target patient sample size, right? All three of you. What was planned? And any suggestions? Last thing is, based on your experiences, your challenges, what you felt, hurdles, give one suggestion to the PGs who are here, who have logged in, how they should, now they are entering. So what is your suggestion to make that dissertation enjoyable thing? It should not be a burden. They should enjoy it and come out with good results. What are your suggestions? Sujit, we can start from.
I think uh, there should be a check, ma'am, for like every monthly updates or 3 monthly updates to know where they are in the dissertation, so that they will not lose the track completely.
Correct.
So mine, it was very tough to very what to say. There was not proper coordination between the guide and me, so I had to take every data at the end of my second year.
Okay.
So we will be giving, we'll be submitting our thesis by the end of 2.5 years. So the time to do that many of the cases were also challenging for me. So when you keep in touch with, when you keep updating those things every now and then you will have that interest and that zeal to do things. What
Okay.
things you can improve, what things you can improvise, what are the things you have done wrong with the previous case. So what could go wrong? So all these things you can discuss, you can have a discussion with your guides or co-guides, so that they can motivate you positively and go ahead with it.
So regular check is what is required, right?
Yeah,
At
yeah,
regular
yes.
intervals, keep a track and
Yeah,
divide the patient. This interval, I'm going to have so many patients recruited. That will
yeah,
add value.
yeah.
You agree with him, Chinmay? Anything from your side? What is
Yes,
your suggestion to the PGs? One is keeping a track.
yes, ma'am. So that definitely keeping a track is very important. And additionally, I would say, like generally the mindset is after we clear the entrance and we start in the first year, generally we're all quite confused because it's a new subject, new environment. And in the middle of that, if the expectation is that we pick up some research topic which attacks directly at something that is missing.
Correct.
This is already
Correct.
an ocean. We already don't know anything, and now we're expected to pick up a topic that is supposed to say, okay, there is a lacuna in this area. So it can be very daunting, but I would say that you can see it as a way of falling in love with the subject that you've selected.
Subject. Yes.
So this is what we've gone through first the 4.5 years. We knew which subjects we liked, we didn't like. Finally, we landed up doing something that hopefully now we start liking, but it can be quite intimidating. So I guess selecting a thesis, it keeps you as an anchor. It reminds you that, okay, this is why I joined. I really like this topic. This is something that I find meaning in. I think I can contribute to this space. So it's not just for an RGHS requirement, but it's also, it keeps you as an anchor through the 3 years. It
Anchor.
reminds
Yes.
you that this is why I took this subject and I think I fit in here. So that we're keeping
Great.
that in mind, if a topic would be selected, I think there would be no resistance or nothing.
Correct. Correct. That's great. Ganavi, what is your suggestion?
Yes, ma'am. As Chinmay rightly mentioned, it's important to understand what are your interests, and secondly, it is also important to know if if it is feasible to conduct the study there, because after 2.5 years you will have to submit the thesis, which is very important for your academic progression. So it's important to understand if the study is feasible, if I'll be able to do it, because there are some branches which will give you no time at all for conduction of the studies, and all that time I think it's important you go for a feasible, a basic one, which you can give justice as well, just not doing it for the sake of doing. So whatever it is, just give 100% of yourself for conduction of the study, and understand, like, if you're choosing the topic of your interest, why? Because you will learn a lot about that particular area apart from the studies which you are doing, apart from the theory you are studying for your exams or the cases you're seeing. This thesis topic, you will be learning a lot more about it. So if you're already interested in it, I think it will be easy for you to learn more and you will enjoy it. So that's what I say. And understand the people you will be dealing with once you take up this study. If you're doing any cross collaborations and all with the lab or with the other stakeholders, there it's important, okay, if it will be feasible for me, if I can deal with this, if I'll get the time to do other work also. So that understanding that is also important. So at the end of the day, if you're in clinical, the primary aim is to give the treatment and patient care. That along with that, you will have to take this study parallelly. So just it is important to maintain that fine balance about going for the newer topic and topic of your interest, along with that maintaining that feasibility. Yeah, I would say. Yeah.
Perfect. Excellent inputs, and I am happy I chose the best who have done very well in the dissertation. And I'm sure any questions from the participants, one or two we can take, and then we close. Any questions from the participants? Anybody would like to know from your seniors? They have done very well. And we can see from their, suggestions on how passionate they were. I think there is any question? Anybody has any question? Anybody wants to know?
Hello, ma'am.
Yes, please. Vinod? Yes, please.
I just want to ask mainly for the Ganami ma'am and Chinmay ma'am, and then for the sir also. So the thing is like, how did you did do you run the test, the statistical test? Did you consult any statistician, or did you learn it by the like any material or something like that? Or how did you go do it, and how did you choose the variability? And already definitely before doing the synopsis, definitely you would have selected the variability, what you have to do, what are the tables you have to look for. But still, how did you do that? Like, how did you choose it? Is it like, how did you manage it? That's the only question.
Yes, Ganavi, you can answer. Chinmay, you can answer. Chinmay. Yeah, one after.
Right. So there's definitely the statistical analysis. That's where the statisticians play a very big role. But what I've noticed is they need our help as well, because they will also not be fully familiar. Only we will know what the best in our subject. So they would be more like, again, like I think Dr. Ravi Kiran mentioned, like AI, they will also be a friend who will just do the analysis that we want. So while they were doing the analysis, I also was trying to read up about the different statistical tests and what should be used for this particular variable, what kind of comparison. So here again, I think AI does play a role, because at least we are able to understand what it is. So if we pull up an article, this has happened with me. They mention a bunch of very, very complicated sounding tests. We may or may not be familiar, and that just makes us more confused. So just looking up the individual exact tests, that just puts it in a very simple perspective. So using articles, Google or AI to at least understand what it is this test is doing before you approach the statistician. And then you have to discuss with the statistician saying, this is the output I want. I'm comparing these two. And then you have a to and fro discussion with the statistician. So everywhere there's a sort of active involvement from our side regarding our analysis and our statistics.
Let me tell something, Pratibha. So as Dr. Chinmay said, the student has to understand the statistical methods completely, and through your AI or the Google, all that. And when you approach the statistician, you will have your doubts. So you can ask them, when the statistician says this is the method you're going to apply, then you can definitely ask it, why not this? And this is what I was told, so this is what I have understood. And why this and why not that? So they will also know that you know everything. The statistician knows that you know everything and you want the just right thing to be done. They also understand that, and they explain to you, so it becomes mutual and you get the best out of it. So it is very important for a student to know the complete statistical methods and a prior sort of understanding, okay, this must be the right thing for me. And when the statistician says no this, and when you ask questions, you will understand it more. That is very important.
Yes,
Thank you.
Yeah.
Any other questions? Then we can move to other panelists. Any other questions? I think that was convincing, right? We know. Yes, Sagarika.
Ma'am, I have a doubt. I'm a faculty in the college, so the first year PG has selected a topic, a biomarker, that is glycated albumin in GDM cases. It's a gynec topic, and she has inquired about, which is not routinely done in our hospital. So she has inquired about the procedures, all that, the kit charges, how to avail that, how much procedure cost will be there. So it's roughly about 1,000 rupees patient has to pay, but it is not feasible. Yeah.
Per test. Okay.
For the test, because it is not
per patient. No, let me understand. Per patient, she has to spend 1,000.
Patient has to pay 1,000.
Patient has to pay. Oh,
yeah.
Okay.
So we have talked with our Bichem madam. She will run the test, but patient has to pay. But it is not feasible that we don't want patient has to pay so much. So is there any provision for any funding?
Yes.
From the college we can apply for PG thesis. Is there any provision? Just I want to know.
Yes.
Or it is institution based?
No, as you said, you can talk to institute like how Chinmay has done. She paid for the kit. So have a negotiation. Vaidehi also did that. Atal Bihari also said that, because wherever we go to institutions, the management is happy to, help you.
Mhm.
You have to talk to them and say, we provide the kits, get it done. They are happy.
Okay.
No problem. That is one option. ICMR is funding for PG thesis. They are
Okay.
going to call along with the student STS project. ICMR will call. I shared one MPS con also, but that is for pharmacologist. I think they are giving 20,000 per project. So your association, your specialization is ENT, right, Sagarika? No,
Gynec, ma'am.
OBG, huh? OBG, that your Foxy and all will be, they will have some funding for postgraduates. Inquire that. ICMR gives, this one gives, and RSSDI has got. Research
Okay.
Society of Diabetes of India. They have for postgraduates. Keep a track on that. And these are some of the funding agencies. Best would be, before you wait, talk about, negotiate with the management. We provide the kit, and that much you have to spend. Some 20,000-30,000. Postgraduates, if they invest, it will be a very good research project. Otherwise, it will be very superficial, and because for such subjects, biomarkers, and all. Otherwise, you have like intensive care, you have a lot of clinical material. You can do research without biomarkers also, but choose a proper topic. But as I said, feasible one. So this is regarding the investment, right? Okay.
Yes,
Thank you, ma'am.
Pratibha ma'am.
Yes, ma'am.
This was what she's asking, like how, like Dr. Chinmay said, did it in her topic. The cost of the kit only has to be able to inquire from the biochemistry department how much the kit cost would be. One, first of all. Then the technical aspect, performing it, that should not be charged. That is from the institution has to bear it, because it is for the institution also what is being done. Then when the test kit cost is understood, again, who is the supplier of the kit? You can, the kit who supplies, you can talk with them and say this is for a research purpose. And talk to them also. This is for the research purpose we are doing. And so you could, give it at a subsidized cost.
Yes,
it can be negotiated at that end also. And so those companies who are supplying also would come ahead and try to, reduce the cost and give it at a very minimal thing. And that way it can be reduced.
Yes. And some of the clinical labs may not do some of these interleukins and all that. Akshaisarathi has tied up with some research labs who have agreed to do at some minimal cost. If you want, you can write a mail to us. We will connect you with those labs which are doing ELISA-based test at minimal cost for postgraduates. Because if none of these happen at your institution, we can arrange for transportation, pool all the samples, send it, and we can get it done. So that option also I'm giving, but first to try in your institution, what Dr. Sumana said, all those, negotiate with the thing, because locally you should do. Worst situation, I mean, you are at, Sagarika, you are at Coimbatore, right?
No, ma'am, I'm Bhubaneswar, ma'am.
Bhubaneswar, okay. Your institutes, Which institute is that?
KIMS Hospital, ma'am. Bhubaneswar.
No, KIMS is
Kalinga.
They will do. They're very advanced institution.
Yes,
One of the top it is actually in the ranking. Okay. So they will do. Yeah, they will do. 100% they will.
So PG is also very much interested to do this topic.
Yeah, then you talk to them, negotiate the price, and then you can do that.
Yeah. Thank you, ma'am.
Yeah. Anybody else? Any other queries? Okay. So thank you very much, all the panelists and can all of you come on the video mode once? Can all of you come? And Ravi, can you take the screenshot? Can all of you come on the video mode? Quickly. Yes, good. I saw Sagarika for the first time on the video. Yeah, come. Vinod, please. Others also. Sumana, please come. All of you come on the video mode, then we take a screenshot. It is nice to see everybody on the screen. 9 people are yet to join. Please come quickly. Don't hesitate. It's okay. Whatever be the background, whatever, even if you are in a car or outside, just come on the video mode. Ravi, can you take a screenshot with this much? Yeah. So thank you, everyone. And I don't know, I hope all of you have enjoyed these sessions for 1 week. It was our first experiment, and my mentor is Ravi Kiran Andra, I call him my mentor. It was his idea that we do it in the evening online because we wanted to have it offline. And he suggested, let's do. And Ravi, I think to a great extent, it was successful. I'm sure you would have enjoyed, right, Vinod? I think it was effective to some extent. We are also learning. And thank you very much. And with these inputs, I'm sure you will do a very good job. Wishing you all the best. Wish all the panelists also very best in your career. And we are happy to be associated with you guys also. And please continue to be with us. And others also, if you want to join us in any of our endeavors, we are happy to involve you also in one or the other way. You can get an opportunity, because I feel every opportunity gives us more learning. And see how I learned AI from Ravi Kiran, how I learned from Sujit and Chinmay and Ganavi. It's really nice, Wishing you all the very best. And thank you once again. Participants will share the Google form in the WhatsApp group. Please answer those. Only when you complete those answers, you will get the certificate. And you can refer and answer. No problem. You can refer and answer, because anything is learning for us. All right. Thank you. Have a great weekend, all of you. Namaste. Thank you. Thank you.
Thank you.
Thank you, ma'am. Namaste.
Thank you.
Thank you, ma'am.